John, a 48-year man, is referred to an endocrinologist newly diagnosed diabetes mellitus. He had increased blood glucose level from last few weeks. The endocrinologist discussed different treatment option with the patient like oral antidiabetics and injectable insulin preparation. Endocrinologists prescribe a unknown drug which increase the risk of lactic acidosis and vitamin B12 deficiency. This drug has a special action on liver and inhibit glucagon hormone secretion. Liver cells demonstrate increased concentration of the fructose 2,6 bisphosphate. Which of the following will have low rate of conversion? So, before going to the toward the right option of this answer this question, we will discuss the fructose 2,6 bisphosphate. So, fructose 2,6 phosphate regulation is an important substrate for the regulation of the glycolysis and gluconeogenesis. So, fructose 6 phosphate is a substrate that convert to fructose 2,6 bisphosphate by enzyme TFK2 phosphofructokinase 2, and this substrate fructose 2,6 bisphosphate may convert back to fructose 6 phosphate by enzyme fructose bisphosphatase 2. So this substrate fructose 2,6 bisphosphate is substrate that lead to the increased level of PFK1 phosphofructokinase 1 enzyme. This enzyme is a rate limiting and in rate determining enzyme for the glycolysis pathway, and this fructose 6 phosphate converted to fructose 1 6 bisphosphate. So this phosphofructokinase 2 enzyme is induced by insulin. The patient takes oral antidiabetics and he has increased blood glucose level, which lead to the increased level of the insulin and increase induction of this enzyme phosphofructokinase, and this ultimately lead to the increased substrate of the fructose 2,6 bisphosphate, and this will lead to the increased synthesis of the phosphofructokinase 1 enzyme, which is the rate limiting rate determining enzyme for the glycolysis. Let's suppose that if the patient is suffering from, if the patient suffer from the fasting mean increase glucagon. So increase glucagon, which lead to the increased synthesis of this enzyme FBPase, fructose bisphosphatase 2, which cause fructose 2,6 bisphosphate to the fructose 6 phosphate, and this pathway move towards the gluconeogenesis. So gluconeogenesis. So the in this clinical vignette, the patient taking oral antidiabetic injectable, which has the increased risk of the lactic acidosis and vitamin B12 deficiency. So which oral antidiabetic has the increased risk of the lactic acidosis and vitamin B12 deficiency? It's a metformin. So metformin is the first line drug in the diabetes type 2. So the metformin mechanism of action is metformin is inhibit gluconeogenesis in liver and inhibit glucagon secretion. Another high yield stuff. What is the advantage of taking metformin? So metformin also has the weight losing effect. Insulin has another effect. It will lead to the increased synthesis of the glycogen synthase enzyme. So glycogen synthase enzyme is the rate limiting and rate determining enzyme for the glycogen synthesis. Increase glycogen synthesis. While glucagon has opposite effect, it will lead to the increased synthesis of the glycogen phosphorylase. Glycogen phosphorylase enzyme, which lead to the increase glycogenolysis, increase breakdown of the glycogen. So the one thing, the insulin increase the insulin to the glucagon conversion. It lead to the increased conversion of the fructose 6-phosphate to the fructose 1-bisphosphate. So another effect of the insulin, the product of the glycolysis is the pyruvate. If oxygen is available, it convert to the acetyl-CoA, and this acetyl-CoA may goes to TCA cycle where NADH, FADH and GTP are produced. NADH, FADH and GTP, while it may go to the fatty acid synthesis. So the insulin also increase acetyl-CoA to fatty acid conversion. While this is another reaction, alpha ketoglutarate to the glutamate. This is basically the transamination reaction. So this transamination reaction takes place in the liver where the alpha ketoglutarate is converted to the glutamate. Alpha ketoglutarate. It receives the amino group from the alanine. And this alanine is converted to the pyruvate, and this pyruvate ultimately converted to the glucose. So this is the only reaction. This is the only reaction that is inhibited by fructose 2,6-bisphosphate and insulin. So the right answer is the decrease conversion of alanine to glucose. This is the right answer of this question.